Good evening all. Today our class is about wrist joint. Wrist joint is very important for 15 marks question as well as 5 marks question. 15 marks as well as 5 marks. Okay. So listen, watch the diagram carefully because it is little bit confused diagram. So I will explain the diagram first. This is radius, this is ulna, this is scaphoid bone, this is lunate, this is triquetral, this is pisiform, this is trapezium, this is trapezoid. I will write here, this is trapezium, this is trapezoid, this is capitate, this is hamate. Okay, I hope you all understood the diagram. Okay, now while studying about the joints, the type of joint is synovial joint of ellipsoid variety. The wrist joint belongs to synovial joint and its variety is ellipsoid variety. Okay, the joint is placed between the radius, ulna and 3 carpal bones: scaphoid, lunate and triquetral. Scaphoid, lunate and triquetral. Pisiform does not involve in the joint because it is interlinked with this trapezoid, triquetral. Okay, so these 3 bones involves in the formation of joint, wrist joint. Okay, next the articular surfaces. The upper articular surfaces are lower end of radius and lower end of ulna, and lower articular surfaces are upper end of scaphoid, upper end of lunate, upper end of triquetral. I repeat again, upper end. See, lower surface of radius, lower surface of ulna, and when it comes to the lower side, upper end of scaphoid, upper end of lunate, upper end of triquetral. Okay, this is all about articular surfaces. Now coming to the ligaments. The first ligament is articular capsule. Okay, the first ligament is articular capsule. It is attached to the articular capsule, means the capsule which helps in the articulation of 2 bones. Okay, so it is present between the lower end of radius and ulna and upper end of scaphoid, lunate and triquetral. Okay, next here there is, see, I will pick this one, this part. It is called as recessus sacciformis. It lies in front of the styloid process of ulna, in front of articular disc. Okay, this is articular disc. It is present in front of articular disc as well as the inferior surface of the styloid process, near the styloid process. This is articular capsule. Next one is, second capsule is palmar carpal ligament. Okay, palmar carpal ligament. In palmar carpal ligament there are 2 types. One is palmar radiocarpal ligament. Second one is palmar ulnar carpal ligament. Palmar radiocarpal ligament and palmar ulnar carpal ligament. Now we will study about palmar radiocarpal ligament. Palmar radiocarpal ligament is broad band. Okay. Next, it begins at the anterior margin. This is anterior surface. Okay. Anterior margin means corner, anterior margin of lower end of radius and its styloid process. Okay, it begins at this point here. It begins at here. Okay, and runs downwards. See, runs downwards from this side, from here to here. It coming downwards and towards medial side. Okay, I'm sorry, it is coming from this side, runs downwards towards medial side. Okay. Next, and it attaches to the scaphoid, lunate and triquetral cells. Next one, palmar ulnar carpal ligament. Palmar ulnar carpal radial ulnar carpal ligament attaches to these 3 bones: scaphoid, lunate and triquetral. Ulnar carpal ligament only attaches to lunate and triquetral, and it begins at the base of the ulna at the styloid process and comes downwards to the lateral side like this. Okay, this is all about palmar carpal ligament. The third one is dorsal radiocarpal ligament. Dorsal radiocarpal ligament. Dorsal means opposite side, dorsal side. Okay, this dorsal side is weaker than palmar ligament. Okay, it is weaker ligament and it begins from the posterior margin of lower end. See, it begins from here but in the posterior region, inferior surface of radius and ulna, and runs downwards medially and attaches to the dorsal surface of I mean it begins only at a radius. Okay, it begins at radius and attaches to scaphoid, lunate and triquetral as same as this one, palmar radiocarpal ligament. Dorsal radiocarpal ligament is same as that of palmar radiocarpal ligament but in the dorsal surface. The fourth ligament is radial collateral ligament. Radial collateral ligament that belongs to radius. It extends from the tip of the radius to lateral side of scaphoid bone. See, it extends from the tip of radius from here to lateral side of scaphoid bone. From here, for example, I will write here from here to lateral surface. This is lateral surface of scaphoid. From here to tip of styloid process to lateral surface of this scaphoid bone. It is related to radial artery. And fifth one is ulnar collateral ligament. Ulnar collateral ligament is same as radial collateral ligament. It extends from the tip of styloid process of ulna. Styloid process of ulna to the medial surface of triquetral and pisiform. Okay, medial surface of triquetral and pisiform. This is all about these ligaments. There are 5 ligaments, and the palmar carpal ligament is divided into palmar radiocarpal ligament and palmar ulnocarpal ligament. Now we comes to the relations. It has 3 relations: anterior relation, posterior relation, as well as lateral relations. First one, anterior surface. Anterior surface, there we have long flexor tendon with synovial sheaths and median nerve. Long flexor tendon with synovial sheath and medial nerve. And the posterior surface, we have extensor tendon of wrist and fingers with their synovial sheath. And at the lateral surface, we have radial artery. At the lateral surface, we have radial artery. At posterior surface, we have extensor tendons of wrist and fingers with their synovial sheath. And anterior surface, we have long flexor tendons with their synovial sheaths and medial nerve. This is all about relations. And our next concept is very important concept, blood supply. Very important for 2 marks as well as in the viva section as well as in the essay question. See, blood supply and nervous supply is very easy in wrist joint. The blood supply is anterior and posterior carpal arches. That's it. Anterior and posterior carpal arches. And when it comes to the nerve supply is anterior and posterior androidicious nerves. Anterior and posterior androidicious nerves. And blood supply is anterior and posterior carpal arches. Nerve supply is anterior and posterior androidicious nerves. These two are very important concepts in 2 marks as well as in the viva section as well as in the essay question answer. Next, we comes to the movements. Movements are flexion, flexor carpi radialis, flexor carpi ulnaris, palmaris longus. These 3 measures helps in the movement of flexion. Next, extension. In the extension, same as like flexor, extension carpi radialis longus, extension carpi radialis brevis, extension carpi ulnaris. See, same as like flexion, the extension measures are also same. Next, I will repeat again: flexion, flexor carpi radialis, flexor carpi ulnaris, palmaris longus. And in the extension, extensor carpi radialis longus, extensor carpi radialis brevis, extensor carpi ulnaris. Okay, these are flexion and extension. Now comes to the abduction. Abduction, flexor carpi radialis, extensor carpi radialis longus, extensor carpi radialis brevis, adductor pollicis longus, and extensor pollicis brevis. See, 5 measures: flexor carpi radialis, extensor carpi radialis brevis, extensor carpi radialis longus, adductor pollicis longus, extensor pollicis brevis. This is for abduction. And now for adduction. Adduction, we have flexor carpi ulnaris. For adduction, flexor carpi ulnaris. For abduction, flexor carpi radialis. And extensor carpi ulnaris. For adduction, only ulnar muscles are functional here: flexor carpi ulnaris and extensor carpi ulnaris. Next, our 5th movement is circumduction. Circumduction means complete 360 degrees rotation, so that all the muscles included in flexion, extension, abduction and adduction are included in circumduction. Okay, this is all about movements. Now the important point is clinical anatomy. Very important for 2 marks as well as in the viva section as well as in the essay question answer. See, in clinical anatomy, the most common is rheumatoid arthritis. It is autoimmune disorder. it is most common. Okay, next second one is ganglion cyst. Ganglion cyst, that means there is a cyst formation at the dorsal surface, that is here in the dorsal surface. There you can see the cyst at here. Okay, that is called ganglion cyst. Okay, next rheumatoid arthritis, ganglion system. And the third one is, see, we can rotate the wrist joint only up to 30 degrees. We cannot turn this more than 30 degrees. This is also belongs to clinical anatomy. Dorsiflexion, this we call it as dorsiflexion. We can flex the hand from dorsal side, this like this, dorsiflexion, only up to 30 degrees. We cannot rotate more than that 30 degrees. Next one, any injury may cause subluxation. See, subluxation is common in elbow joint as well as in the wrist joint. Subluxation of carpals. Any injury may cause subluxation of carpal bones. Okay, this is clinical anatomy. I repeat again, rheumatoid arthritis is most common. Next, ganglionic cyst. Next, dorsiflexion up to 30 degrees only. Next, so any injury may cause subluxation of carpal bones. Okay, this is all about our class today. This is our notes, wrist joint. It includes only 3 pages. Okay, listen the class carefully and completely, then go through the notes, or otherwise you cannot understand completely and you cannot remember it for a long time. Thank you all.